Sabrina. I'm going to be your nurse today.
Hi.
I'm going to do some hand hygiene really quick. Can you tell me your name and date of birth?
Alex Fabiano, 3/17/2001.
Awesome. I'm going to check your wristband. Thank you. Can you tell me what brought you in?
I had a cold a few weeks ago, and this was just the earliest I could get in, but I'm feeling fine now.
So do you have any current complaints? Specifically, do you have any like shortness of breath, cough, wheezing?
No, it was just like a lingering dry cough, but it's pretty much resolved at this point. Like it's only triggered if I'm like cold or something were to happen, but other than that, I'm fine.
Okay. I'm going to do a quick physical assessment on your, I'm going to focus on your lungs and your respiratory assessment, but I'm going to do a general overall physical exam really quick.
Okay.
So I'm going to start from head and then move down to your lungs. I'm going to check things like your skin, look at the perfusion, make sure you're getting enough oxygen out in your blood. I'm going to check your face, and then I'll listen to your lungs, and then we'll move forward from there. So can you go ahead and give me a smile? Can you stick out your tongue? Move it side to side. Okay, can you feel over here?
Mhm.
Feel over here?
Mhm.
Do they feel the same?
Yeah.
Okay. That looks good. Looks like your nerve is intact in your face. Cranial nerves are intact. And then I'm going to check your fingernails, make sure. Okay. Capri feels good. Looks like you have good perfusion in your nails. Your lips are pink. No sign of cyanosis there. Alright, next I'm going to check the symmetry of your shoulders. Make sure everything looks symmetrical. Are you okay with me palpating on your shoulders and your chest?
Mhm.
Okay. Good, that looks symmetrical. Chest is symmetrical. I'm going to check your back, make sure everything looks good there. Upper and lower back looks symmetrical, and your shoulders look symmetrical as well. Are you having any pain in your back anywhere?
Mm-mm.
No? Okay. Next, I'm just going to watch you breathe normally for a little bit. I just want to check that there's no respiratory distress, no, retractions when you're breathing, no signs of stridor, things like that. So just go ahead and breathe normally for me. Okay, rate and rhythm looks good there. It doesn't look like you're having any signs of respiratory distress. You're breathing through your nose easily. Do you feel like you're having any congestion or things like that?
No, I actually feel pretty clear.
And I don't feel any retractions when you breathe. Okay. Now I'm going to assess the AP diameter of your chest to the transverse diameter. Make sure that the ratio looks good. Good. Alright, that looks like a 1 to 2 ratio, so that looks good. Now I'm going to assess the costo angle down here. Make sure it's at 90 degrees. And midline, so that looks good. You are at 90 degrees there. Then I'm going to assess your trachea. Just make sure that's midline, no deviation, lumps. Do you feel like you have any difficulty breathing in your throat?
No.
Okay. Is there any pain with that?
Mm-mm.
Okay. So trachea is midline, no deviation there. Next, I'm going to assess the thoracic muscles. Just make sure you have even and good muscle tone throughout. Any pain with any of that?
Mm-mm.
Okay, muscle tone is within defined limits. Now I'm just going to watch your respirations for a full minute, make sure that everything is normal. So just breathe normally for me as best you can.
Okay.
I'm going to start. respiratory rate is 12. Do you feel okay with that?
Mhm.
Okay, didn't like you in any distress. Now I'm gonna check for thoracic rise and fall back here, make sure it's even. So just go ahead and give me a few deep breaths. Alright, that is symmetrical and even for rise and fall. Now I'm going to listen to your lung sounds. I'm going to be assessing to make sure it doesn't sound like there's any fluid or wheezing, that all sounds good. I'm going to be listening to a few different sets of lung sounds. The first lung sounds I'm going to listen to is bronchial lung sounds. Okay, so just a few on those. Just go ahead and breathe normally for me. Now I'm moving on to the bronchoventricular lung sounds. That all sounds good. Now I'm going to listen to anterior and posterior vesicular lung sounds. Last thing I'm going to do is listen to your bronchovesicular and vesicular lung sounds in the posterior aspect. So I'm just going to have you breathe normally like you were for me. Alright, everything sounds really great. Your lung sounds are clear throughout with anterior posterior lung sounds. Do you have any complaints regarding your breathing? Do you feel like everything's cleared up?
Yeah, I feel like everything's completely clear.
Alright, you look great overall. So that I'm finished with my assessment. If there's anything else that you have a problem with, just let me know.
Okay, thank you.
Have a great day.